Hello, welcome to this new course. I have used, I actually didn't tell you what, was not very confident of creating this course. But I found that though this course is on Peyronie's disease, huh? Okay, though many of you may not have heard of this term at all, so this will be all Greek to you. But remember that this disease is very rampant in our society. Okay, so I've found this in my outpatient departments, in my practice, and I found numerous patients, countless patients. Okay, you may not believe me, but there are a lot of these patients who silently suffer. Okay, and this is basically a physically and psychologically a very debilitating disease. Okay, and people who often cry when they come to me and they are suffering from this disease, because it is a very difficult situation for the patient himself, the male person, and also to his partner. So both feel very frustrated from the situation. Since it is not a malignancy, since it is not an infective disease, they are not able to understand that they're suffering from a disorder like this. Okay, now as you can understand, the purpose of me making these courses and coming to you in this fashion is to make you understand that all these disorders now, that is the basically the concept of primary prevention. All these disorders can be picked up at the very early stage, and if they're picked up in the early stage, there are less chances that you will be suffering from the consequence of the complications of these disease syndromes. Okay, now Peyronie's disease, basically Peyronie's disease. Just let me share me this whiteboard, so I will be able to show you better. Okay, what happens in Peyronie's disease? Suppose this is the male phallus or the penis. In Peyronie, there will be curvature of the penis. Now you can say that many of us have a normal. Our penis not when they erect. Now they're not in the 90-degree position. They're often curved to sometimes to one side or the other. So these are normal curvatures, but these are basically exaggerated curvatures. Okay, exaggerated curvatures in the sense they can be curvature from this axis. So this is the straight line, and this goes to one side, or it can be a curvature like this, or it can be curvature like this. So there is a formation of a plaque, that's a hard substance, or something looks indurated when you palpate, okay, at that angle, at the bend. So these patients also suffer pain during intercourse. They have pain during interpain, not only during intercourse. Whenever their penis become rigid or erect, they have pain, severe pain, debilitating pain. You can understand now, a person having pain while this penis gets erect is so much frustrating. And I can tell you why. I tell you what is that there is recent data which shows about 1 million Indians are suffering. It's a new patients which are coming up in a within a year, and that is also being underreported. So the if the total, if all these mild symptoms and patients without having pain or non-debilitating problems do being highlighted, because they don't come because of embarrassment. What will they tell to their relatives, that, or that to the doctor, that they have pain during sex and that they have a curved penis, they have a penis which is deformed? They don't come, they don't report this, they bear it silently. That is the problem. That is because of this the underreporting happens. Okay, so what really happens is that there is a curvature, there is a hard nodule or a plaque or an induration on the penis, and the patient has ED, or the erectile dysfunction. That is the main problem. So basically most patients come with problems of ED, and they say, I have a pain in my penis and I have something, a tumor like, I'm very scared. When they feel that tumor like, that hard substance on the penile shaft, then they feel, okay, something is going to wrong, I have a cancer of the penis or something like that. I've read in the internet, I've read it in the Google, and I'm having cancer of the penis. It's not cancer of the penis, my dear friends. Okay, so we will talk about cancer of the penis. What is that? What That will be a different issue, but this is very common, no? Carcinoma penis doesn't cause any pain in and this is the typical symptom of a Peyronie's disease. Okay, so so that is a very important thing. And why do they suffer from it? It has been found that that is due to repetitive trauma. Trauma means injury, small injury. These are mild injuries where the patient doesn't understand that they are suffering, that they had this that injury while having sex. Often happen when the person has a soft penis. and they have been forced by the partner to have sex, so they don't have that that intensity in the mind that I will have a sex. So they have mostly, there's a hyperactive sexual disorders. Okay, they're not excited enough, they have to do it. Okay, let's do it, let's just like that. So in this patient, the penis is soft and it gets repeatedly injured during intromission against the pubic bone. So there will micro trauma, there will be small injuries to the blood vessels, small blood vessels, small amount of hematomas, and all they get fibrosed, okay, in the long term. So as I said, there's a lot of treatment, Morales, medical treatment, surgical treatments, and from the variety and from the innumerable options of the treatment, which does not guarantee a cure, you can understand that this treatment, that the disease is still an enigma. That's why I'm calling Peyronie disease as an enigmatic disease. But people do suffer silently because people don't know that they're actually suffering from this problem. Okay, my dear friends. So as I said, this is what I said. It's an overview of the disease. I will come to dissect one small parts of it in the next few modules. So stay in touch and do ask me questions. Okay, I can understand that this being a very embarrassing situation, people don't interact so well. Okay, interact so well. But even in that, we would be, even if you don't interact, okay, my dear friends, even don't interact, try to go through these videos over and over again, because there will be small nitty-gritty points which you may feel, which, because the biggest thing I told you now, our main individuals are that we have this ostrich mentality. We put our hands, put our heads inside the this all this sand, and feel whatever happens, happen to them, happen to others. I'm not bothered. But the situation can happen also to, can affect all of us individuals, my dear friend. Okay, fine. So this is the overview part. I will be coming back to the next about the problem and the anatomical aspects, so that make you more clear what is this disease. Until unless you know now what is this disease, you will not be able to take the appropriate appropriate measures by yourself. Okay, so you can control it by home remedies, even home remedies in the very early part of the problem. Once it goes to some extent, then it's over. Now it becomes a irreversible problem. Okay, so that's it, and meet you in the next module. Bye bye.